Stephen Hunger. I'm Chief of the Division of Oncology.
Dave Teachey, a physician in oncology.
Acute lymphoblastic leukemia is the most common cancer in childhood, and about 85% of it is a B lineage acute lymphoblastic leukemia, or BALL. Now, if you go back 60 years, this was incurable. We first started seeing cures in the 1960s. And we made a great deal of progress between the 1960s and 2010, optimizing how we give chemotherapy, but we started to reach the limits of how you could improve outcome with chemotherapy. And new immune-based therapies, or immunotherapies, came into play, one of which is a drug called blinatumomab. And in about 2014, we were starting to design a large national trial in the Children's Oncology Group, and we were going to test how to optimize some older chemotherapies, but at the time we started to see blinatumomab greatly increased survival in relapsed leukemia, and we said maybe we should move this right to patients with newly diagnosed leukemia.
And what we found was with this exciting immunotherapy that it really improved cure rates dramatically. So this was a study that was stopped early because the difference in cure rate was so much better than historical. And what we call is event-free survival. And events are things like the cancer comes back or the child doesn't survive, went from 88% to 96% at 3-year time point of looking at the outcomes of this trial. So a huge improvement in outcome, and an outcome benefit that we haven't seen in any new drug going back decades, probably back to some of those original studies in the 1960s when we were curing children for the first time. It's just remarkable how much it improved outcomes, and it really did it with a drug that's very safe and had very few side effects, so less side effects than we typically see with chemotherapy. And blinatumomab moved the cure rate so high that for the first time we're saying, let's get rid of some of these more toxic agents that we've been using since the 1950s to the 1970s. And the next trial that we have that should open next year for the Children's Oncology Group is asking those questions. Can we finally get rid of some of those agents?